Okay, Jen, whenever you're ready, we are ready to go.
All right, thank you, Pat, and thank you everyone for joining us today. Today we are having our Intermountain Healthcare COVID-19 community update, and today we're focusing on children. Thank you for coming and taking the time to listen to these important messages. We know that the federal emergency use authorization process is continuing for the Pfizer COVID-19 vaccine for kids ages 5 to 11. And in Utah, kids with COVID-19 continue to be hospitalized. So this is a really important issue here. Kids make up about 20%, or excuse me, yes, 20% of Utah's new COVID cases. And of those kids, about half are between the ages of 5 and 10 years old. Kids also continue to be diagnosed with COVID-19 complications, and this includes long COVID. It also includes the rare but potentially deadly multi-system inflammatory syndrome in children, or MIS-C. Today, to help us sort through and understand these matters as well as the vaccine process, is Dr. Andrew Pavia with University of Utah Health and Intermountain Primary Children's Hospital. Dr. Pavia is the the division chief of pediatric infectious diseases at University of Utah Health and the director of hospital epidemiology at Intermountain Primary Children's Hospital. Dr. Pavia will give us updates on the vaccine and emergency use authorization process and talk about when the vaccine might be available in Utah and how you might get it. We thank you all for joining us today. Members of the media, if you could put your questions in the chat function, please. We'll be sure that Dr. Pavia can answer them. And please make sure that you include your name and your news organization when doing so. Dr. Pavia, welcome and thank you for joining us today.
Well, thanks, Jennifer, and thanks for everyone for joining us.
Thank you. Why don't we dive right in and ask the overarching question to help us get perspective here is, why should the community worry about kids getting COVID-19?
I think people have been sold a bill of goods. I've said this many times. Children are really suffering from COVID-19 during the Delta wave. It's in many forms. There's the sheer number of infections. Children in general, since August of this year, 23,000 have been infected. Of kids 5 to 10 years age, which is the group that's soon going to be eligible for the vaccine, it's more than 10,000 since August. And that represents more than the entire school year last year. So what does it mean for kids to get infected with COVID? Well, luckily, the ones who end up in the hospital or end up in the ICU are the tip of the iceberg. Many won't. So let's talk about those kids for a minute. Being infected may mean that you miss many days of school. It may mean that you develop long COVID symptoms. We think that it's about 5 to 8% of children who are infected, even with mild disease, may still be symptomatic 3 months later. It can mean you can infect family members who are more vulnerable, who may actually get very sick or die from it. The other end of the spectrum are the kids who get very sick. And as an infectious disease doctor, I and my colleagues at primary, those are the kids we see and we worry about. And when people tell you that kids don't get very sick, you should walk in our shoes every day. Right now, we're seeing about 8 to 12 children in the hospital because of COVID-19 every day. That's an increase over where we were at the beginning of September and much more than we had last year. Of these, it runs 3 to 5 are in the ICU. The other piece of the story that we've talked about, but I want to reemphasize, is the multi-system inflammatory syndrome of children, or MIS-C. This is a complication that occurs about 30 days or so after infection. It can occur after mild infection, and it is one of the most serious manifestations of COVID in children. We have seen something in the range of 120 children to date with MIS-C. We're seeing an increase now, which is reflecting the increase in infections that we saw after school started in the end of August, beginning of September. Most of the children with MIS-C end up needing ICU care, in contrast to children who are hospitalized with acute infection, with infection in the short term, where it's about 1 out of 3 who end up in the ICU. So this is really, although a rare complication, the one that we fear the most, and that has caused most of the heartbreak that we've seen.
Dr. Pavia, talk a little bit more about MIS-C. What it's multi-system inflammatory syndrome. Talk about some of the organs of the body that are affected and some of the things that you see when kids have this.
Yeah, so the name describes it, but that may not make a lot of sense to people. It is in a syndrome that involves serious inflammation of many organ systems. It typically involves the gut. In fact, many children present with abdominal pain. Some even look like they have appendicitis. The organs that are most hard hit are typically the liver and the heart, and it's the heart damage that scares us the most. There also are neurologic symptoms. The brain can be involved with seizures, confusion, and sometimes even stroke has been seen in the setting of MISC. So it's really quite a bad disease.
Yeah, definitely. We have a question from Ashley Imlay, and she is asking, on average, how many of the 8 to 12 children that you have with COVID each day are from Utah, and how many are from other states? I know direct numbers are sometimes difficult when we're in these types of settings, but can you give us kind of a percentage?
Well, as you know, we provide care to severely ill children throughout the Intermountain West. I'd say on average, probably 3/4 of the children that are hospitalized with COVID and primary children's are from Utah. That obviously varies by day. As we've gotten fuller, we give priority to admitting Utah children. So it may even be a little bit higher. It may even be in the 80% range.
Thank you. Now, tell us, it sounds like MISC is on the rise at primary children's. Is that because of the Delta variant, or is there some other reason?
MISC follows infection, and Delta caused this huge wave of infections in school-age kids, really starting when Delta arrived in July, but really accelerated when school opened, because as you know, we're really not using all of our tools to make school safe this year because of restrictions on the use of masks in schools. So since MISC follows infection, when the wave hit us in September, we knew it was going to show up as MISC 3 to 6 weeks later, on average about 4 weeks later. And for a while, we didn't see it, and we were hopeful that it wouldn't happen, but that wave has broken over us now.
We have a question from Chris Reed that pertains to this topic. He's from St. George News. He wants to know, what exactly is the connection between COVID-19 and MISC? In other words, what happens with kids? Do they get COVID and then immediately go into it, or what are some of the things that you're seeing?
So typically it is a reaction that occurs after kids have recovered. Most of the kids that we see, about a third of them, have had relatively mild disease and recovered fairly quickly. And then these symptoms begin, as I said, 3 to 6 weeks later. The mechanism isn't fully understood. It's an abnormal immune response to the infection. And most of this illness, MISC, is driven by the immune system because the virus is either gone or only in minute quantities at the time they get very sick with MISC.
And we hear about that, parents coming in and saying they didn't know their child even had COVID to begin with.
Yeah, so of the roughly 120 children that we've seen with MISC, at least a third, we only knew that they had previously been infected with COVID because of blood tests. They had never been tested and diagnosed with COVID, and sometimes they had had such mild illness that nobody had noticed. My colleague Nan Trong is one of the 2 leads of a major national study of MISC. And so because of that, we've had the opportunity to really dig deeper and learn more about the pathophysiology of what causes this. But there's a lot left to learn. And the best way to avoid MISC is to prevent infection, even mild infection. Up until now, the ways that we've had to do that have been masking, social distancing, ventilation, all the things you're tired of hearing us talk about. And in the next couple of days, we're going to have a powerful new tool for kids 5 to 10, and that's going to be the vaccine.
Let's talk a little bit about that. Where is the process now? It seems to be, we had an update earlier in the week that the FDA had taken some action. Maybe you could update us a little bit on where we are.
So the process involves first the FDA authorizing the use under what's called the emergency use authorization. On Tuesday, they had a meeting of their outside advisors to make sure that there was an objective, outside, unbiased review in addition to what the FDA had done internally. Then they issued the EUA. All of the paperwork is not out for that. I expect it to be completed by the end of the day today, because part of that is to have the right paperwork, documentation, and ways to make it safe to use this vaccine, which is the same vaccine but packaged differently for children. The next step is when CDC reviews it. Their advisory committee is called the ACIP, the Advisory Committee on Immunization Practices. Their job is to consider what the recommendations are really going to say, which children should be prioritized, what to do for children who may have been previously infected. Are there any other things to watch out for? What needles to use? They are meeting on November 2nd. I think that it's very, very likely that they will vote to recommend it, but they're going to work on the details of that. It then goes to the CDC director, Dr. Walensky. She will usually sign off on the recommendation of the ACIP. And once that's done, the vaccine will start to become available. It will move from where it's currently being stored in the states to doctors' offices and hospitals. We anticipate that at Primary Children, we're going to open a clinic called the Shot Spot. At least I think that's what we're calling it right now. That currently is giving flu shots to children and their families. And starting on November 8th, you're going to be able to get a flu vaccine and COVID vaccine for children, as well as any other family members who want it when they come in. It'll also be available at many large pediatric practices, family medicine practices, and a number of pharmacies. Initially, I think the state is focusing on distribution to larger practices that have already been giving vaccine and are ready to handle it, but pretty quickly they're going to roll it out as broadly as they can.
So when a family comes in to, say, the Shot Spot on November 8th or after, and they want to get the COVID vaccine for their child ages 5 to 11, what if they haven't gotten the vaccine themselves yet, or their older teens vaccinated yet? Is there a possibility of getting all of those vaccines, and how does it interact with the flu shot? I guess I've asked you a lot of questions in one.
So yeah, great questions. So we're going to have both the younger child formulation and the formulation for teenagers and adults. And we would love to help the whole family get vaccinated. Remember, there's no charge. There will be request to your insurance company to pay for the administration fee, but everybody can get COVID vaccine at no cost to themselves. If you also want to get the flu vaccine, then if you have insurance or Medicaid or Medicare, it's absolutely free. If not, there's a small cash cost.
And it's so important to have this vaccine for those who want it readily available. We know that with some information released really periodically throughout the pandemic, there's been more and more information indicating that there are some racial disparities and socioeconomic disparities in COVID-19 cases. Can you talk a little bit about that? Why are those disparities present with this disease?
It's a terribly important subject. Throughout the pandemic, there are groups that have been hit disproportionately hard, and they have tended to be people of color, people of lower socioeconomic status. In the early days of the pandemic, a lot of that probably had to do with the jobs that people had and their inability to work from home. Now, another factor that's contributing is vaccine misinformation. As you know, there's been a flood of misinformation as well as carefully orchestrated disinformation that has had an impact on people's confidence in vaccination. Some of that we know has been targeted specifically at communities of color, at our Hispanic and Black communities. It gets spread organically once it is out there. But we know that there has been real targeting by anti-vaccine groups for these groups that are already at higher risk of getting sick. This all reflects the underlying inequalities in our healthcare system. We've not been able to get equal access to care for everyone in the community, despite our best efforts. And we are redoubling our efforts to really as an organization and as Primary Children's to really try and address health disparities.
Certainly availability that Primary Children's is doing is helpful to that. Can you tell us what it's like at Primary Children's, and have we seen disparities in the children who are affected by COVID-19 in terms of hospitalization here?
So I haven't pulled the actual numbers, but just based on my clinical experience, I've seen a large number of Latinx children. Surprisingly, the American Indian and indigenous population has not been as disproportionately affected in Utah. And I think that's in part because of the incredible job that the Navajo Nation has done, both in non-pharmaceutical intervention and in control in the early days, and the terrific job they've done in getting vaccine out. But we see among children who are very sick and hospitalized, the impact of unequal access to good health care.
And I'm sure we'll see more information coming out about that as the pandemic continues, or hopefully continues not very much longer. We've got a question from Curtis Booker at ABC4. He's asking, and we're coming up on the kids' biggest holiday of the year, Halloween. He's wondering if you could speak to the kids this weekend who may be out trick-or-treating, and many of the events will be outdoors, but what can parents do to ensure that young kids who can't
Jen, you cut out, but I'm going to hope that everyone can hear me and sort of finish that question. So we think that trick-or-treating outside should be pretty safe, and kids should go out and enjoy that. I think the concern is for events that take place indoors. And if you're indoors in a crowded space, children really need to be masked. But remember, there's something that you can already do to protect your children who are too young to get vaccinated. And that is to get vaccinated yourselves and to make sure that everyone around you is vaccinated. We know that children who are in communities with high rates of vaccination, as well as children in families that are fully vaccinated, have had less disease than those who live in communities with lower rates of vaccination. So trick or treat outside, enjoy it. Don't worry about wiping candy off, at least not because of COVID, and avoid being unmasked in crowded indoor spaces. And please get vaccinated.
Some good advice for Halloween. We have another question from Lisa Riley Roche from Deseret News. She says, please talk about what the hospitalizations and long-term impacts of COVID-19 should tell parents about the need to vaccinate their children against the virus.
Sure. I think it comes back to what I talked about initially. You don't know if your child gets COVID-19 and they have a mild case, whether or not they're going to have lingering symptoms. And from a child's point of view, those lingering symptoms may be worse than the 1 or 2 weeks of illness with fever. Think about what happens to a child who spends 3 weeks without the energy to play, to compete in sports, without the ability to concentrate, to keep up in school. That may not seem as severe as an older adult dying or going to an ICU, but as a pediatrician, as a parent, I can tell you that is a devastating outcome that we really would like to avoid, and we have tools to avoid it. Let me also talk about another set of long-term consequences. We haven't talked about that much. So among kids who are very sick and who get hospitalized, there's a small proportion who have organ damage that lingers. It's uncommon, but it is something that we have to think about. We have to be transparent about. Some have had problems with lung function that persists for months. Some have had heart damage that has limited their ability to play sports for months. And this is a rare outcome. I want to emphasize that, but it doesn't have to happen. And letting kids get vaccinated, you're rolling the dice with a rare but severe outcome. The good news is that for MISC is that if you survive the initial illness and once you go home, we are seeing that as we do follow-up at 3 and 6 months, that kids are making pretty good recovery from MISC. And that seems to actually be, in some ways, more reassuring than what we see after hospitalization for acute infection.
More on that line, Lad Egan from KSL TV asking, what is the treatment protocol for MIS-C for children who are hospitalized? And on average, how long do children with MIS-C stay in the hospital?
That's a great question. So the treatment consists of treatments that are designed to quiet down the dramatic immune response. And so it consists of intravenous immunoglobulin, which is the preparation of antibodies in really high concentration from donors that cools off the immune system, high doses of steroids, of corticosteroids, and then sometimes other drugs have to be added that block certain parts of the immune system. Luckily, those treatments seem to work quite well. They're pretty big guns. They're things that we would ordinarily use in really life-threatening immune disorders, but they seem to work pretty effectively. The duration of hospitalization has been pretty variable. It seems to average, I don't have the numbers in front of me, but I would say probably about a week. We've had kids who have spent several weeks in the hospital, in the ICU, on high levels of support. But with the treatments that we now have, we are able to turn the disease around relatively quickly. And the outcomes have been pretty good recently. So we're very pleased about that.
Great. And Lad has a follow-up question. Is Primary Children's Hospital still down on patient beds because of flooding and construction?
So the good news is that we have all the beds back after the flood. And there's a little bit of construction going on, but it's only affecting a small portion. But we are very, very crowded. We're running on any given day between about 93 and 100% capacity. Our big problem, like every hospital in the state, is a nursing shortage. And on any given day, we're typically short about 10 nurses over the number that we need to provide what we consider the very best nurse to patient ratio, the best care. So this is due to COVID, it's due to RSV, it's due to other viruses, it's due to the other things that we need the hospital for, heart surgery, accidents, major trauma. But just like the adult hospitals, we've been running at absolute capacity. The staff has been, we told you they were exhausted in August, and now we're in October. Imagine how they're doing. The work they're doing, I think, is really heroic. My hat's off to everyone in the hospital who's working so hard, but this is really not sustainable.
We have another question. What can a family do to watch for complications due to COVID and MIS-C in kids? In other words, what things should parents look for and know when to get treatment?
It's a very important question. It's not a subtle disease. So it begins usually as several days of high fever. And then the next symptom most often is severe abdominal pain, usually abdominal pain that is bad enough that you want to seek medical care. There may be a rash, there may be red eyes or changes to the lips. Those are relatively uncommon. And if there's already involvement of the heart or lungs, children may become short of breath. They may even appear to be blue around the lips or fingertips. But most children are brought to the hospital relatively early because the high fevers and abdominal pain are not something subtle that you're going to sit around and say, let's give it a couple of days and watch.
Well, that's good to know. A question from one of our Facebook listeners. We have 170,000 children have lost a primary caregiver or parents to COVID-19. Parents who experience disparities are even more impacted. This has been declared an urgent issue by the CDC to be addressed on local levels. Children are greatly impacted by this. Can we talk more about pediatric grief and loss and how it's being addressed as a community?
You've said that beautifully. It's almost hard for me to add to that, but we don't often talk about the impact on children's mental health and all of the things that go with having a sick parent or losing parents and caregivers. That's been an enormous problem nationally. We've seen it happen in Utah. And even if the caregivers survive, many of the kids that have been hospitalized at Primary Children have had a parent who's been in the hospital at the same time, sometimes both parents. This impact is something that we really need to focus on because we know that childhood trauma lingers with children for a long time afterwards. And if they lose a caregiver, that can affect their entire life going forward. I'm glad you brought that up because it's another reason that we can't just say, well, let's let people get infected and see what happens, because these kinds of impacts on kids can't be undone. And we want kids to have every opportunity to succeed in life. We have really worked on the grief issue. Our behavioral health team has been involved with children who are hospitalized whose parents are sick. But what I would say is that if you know of a child who's grieving because of a loss of a parent, loss of a grandparent, please get them help, because counseling is really important to children to help them through that kind of grief.
Absolutely. And we have information on primarychildrens.org. If you go to that page and see the behavioral health page, if you click on that, there's resources for intake and other resources for parents regarding grief or supports for behavioral health in your children. And we want to give a shout out to Susan Chapman on Facebook. Thank you for submitting that question. We have another question from Chris Reed. Is Primary Children's Hospital drawing young COVID patients from throughout the state? For example, are you seeing child COVID patients from Southern Utah?
Yes, children are transferred here if they are severely ill and they need high levels of care. Because the hospital is so full, for kids who need hospital care but are more moderately ill, we've tried to help facilitate them getting care closer to home. Normally, we might have transferred them, but often we've not had enough beds to take everyone, say, from the St. George region up here. So if they need intensive care, if they're very sick, if their diagnosis is in doubt, that's what we're here for.
Do we have telehealth tools that help maybe physicians in outlying areas help children with COVID-19?
We do. I will make an editorial comment to say that Intermountain has been a leader in developing telehealth for adults, but that has not received the same priority for children. So many of the telehealth services are just being stood up and brought up to speed now, but we are providing support to doctors and other caregivers throughout the region. One thing that is worth mentioning is that telehealth during the peak of the first waves of the disease was allowed to occur across state boundaries, where normally there would be licensing requirements. Unfortunately, for some states, that emergency authorization has been withdrawn. So we as Utah providers can't provide care for children in Nevada over telehealth links and some other states unless we have a license in those states. That's something that I would like to see reversed. I think we really need to expand the ability to do telehealth without going through onerous licensing in multiple surrounding states.
Certainly, and we are so glad that Primary Children's is expanding its network to provide more care close to home and to connect with physicians elsewhere by telehealth or otherwise. So thank you, Dr. Pavia, for those comments. I'd ask Dr. Pavia if you could provide just some closing remarks and things that you'd like us to remember, and then I'll ask one final question.
I think it's really important as we get closer and closer to having the vaccine out for people to understand that children 5 to 10 can get really sick with COVID. And even if they don't get really sick, their lives can be disrupted. We have a vaccine which is very effective and very safe. And it's a real crime that it's been politicized, that there's been the spread of misinformation, because it has made it very difficult for people to really understand the risks and the benefits of the vaccine. And the benefits are really large. There are, with any medicine, some risks, but they are dwarfed by the benefits of getting vaccinated. So I urge you to think about it, to talk to your care provider. And in most circumstances, I really think you're going to want to get your child vaccinated as soon as you can.
Definitely, I'll ask one more question. Where can parents go for more information on the COVID-19 vaccine for children?
There is very good information that is going to be posted on the Utah Department of Health website. As soon as the CDC meets on the 2nd. They will be posting terrific information. There are trusted commercial sources like WebMD. What I would urge people to be very cautious about is places like Facebook. You know, a friend of a friend of a friend on Facebook is not an expert on vaccines. And please go to trusted sources. But I think for many people, your most trusted source is going to be your pediatrician or your family physician. And please take advantage of their expertise and talk to them. They're dying to answer your questions.
Thank you, Dr. Pavia. Thank you, media, for joining us today and for your questions. Thank you to all of you on Facebook who joined us as well. Dr. Pavia, thank you for your time.
And Jen, if I missed resources on the Primary Children's website that you want to provide links to, you know, please provide those. But
absolutely, thank you. Thank you for the reminder. We have other information at Primary Children's Hospital website. There will be information there, and at intermountainhealthcare.org as well. And thank you again, Dr. Pavia, for your time, and thanks all for joining us. That's all for today.